Colorectal cancer, particularly metastatic colorectal cancer, we've created this new subclass of patients with liver-dominant or liver-only metastatic colon cancer. And we've got all sorts of tools and new effective ways of managing that. And part of my thinking is, should we begin to carve out really its own pathway, its own strategy for these kinds of patients. And I really spent most of the time reviewing the knowledge that we have today. We have this belief that we should be giving chemotherapy around the time of a surgery for liver metastasis, and yet there really isn't any solid evidence that says that that chemotherapy will add benefit to patients. So it doesn't really have a, quote, adjuvant effect like we'd like it to have, meaning more people are cured if you give chemo than just doing surgery. And there really has only been shown a minor improvement in progression-free survival. So I actually believe personally that this is a different kind of animal. The surgery either cures patients or you have to treat them to progression, or at least wait to Mets recur and then manage it that way, just thinking of them as metastatic disease. But then there's this other group that has come out, and these are liver-dominant patients who can't have surgery. And it is this group where we've got some new exciting tools. Traditionally, we've been given just chemotherapy until they drop. Well, now we've got more and more evidence that liver-directed therapy, whether that's chemotherapy, or the latest bell and whistle is called Y90, yttrium-90, where that's injected, can treat and control liver metastases for an extended period of time. And the primary study that I reviewed was the SURFLOX study. And SURFLOX randomized patients between chemo only, FOLFOX-Bev, versus FOLFOX-Bev plus Y90, right at the beginning, not when we normally have been using it as a salvage refractory therapy, but right at the beginning during the first cycle. And what this showed was, at least in the liver, there was a 12-month versus 20-month liver progression-free survival. So a big piece of change, almost 8 months improved outcome in terms of liver-specific progression-free survival. There are 2 other studies that are coming before the overall survival analysis will be done. Now, the trick or the problem with this is that in this study, patients were included who had extrahepatic disease, so they could have small volume lung disease, some lymph nodes, that sort of thing. So the overall progression-free survival was no different between the 2 arms. We'll figure this out. Does liver-dominant disease deserve upfront liver-directed therapy or not? We'll know it for sure in about a year when the overall analysis is done.